Osteopathy developed around the late 1800s as a form of manual therapy to treat various pain and general health problems. Well, osteopathy in general actually covers a wide variety of different treatment styles. In the clinics here we use what could be loosely termed structural osteopathy for orthopaedic conditions such as back pain, neck pain, sports injuries, that sort of stuff, and therefore we use a lot of deep massage, a lot of articulation, a lot of stretches, manipulation if we need to as well. So it's a very hands-on form of therapy in terms of what we do. There are lots of overlaps between the three professions of osteopathy, physiotherapy and chiropractic, but also some differences. But I would say there's also lots of differences between the individual therapists within that profession. So there's lots of differences between individual physios, individual osteopaths and individual chiropractors. What I think is important is that people go to somebody who they trust and go to somebody who's perhaps recommended and they know who's going to be able to do them a good job. It's certainly true that some osteopaths, like some chiropractors and some physios even, will use a lot of cracking techniques with their patients. For us, for our osteopaths, yes, we do use manipulation, but we'll use that relatively sparingly and in combination with lots of other techniques as well. What's actually happening when a joint's being cracked is essentially it's a bit like when you crack your knuckles in your hand. There's a gas bubble that's released within the joint as the joint surfaces are slightly opened and separated. In terms of safety, it's generally speaking actually quite a very safe technique. There are a few situations where you have to be careful, so the main two would be when considering doing a manipulation on the upper neck, because there's certain blood vessels, tortuous blood vessels, which could be quite delicate in certain situations there. So that needs to be quite done with lots of precaution and very sparingly. And the other one probably would be in patients who have got quite delicate discs. So if they've got a slipped disc, a torn disc, again, has to be relatively careful with that. It could end up with the disc becoming worse. It can sometimes actually be a very useful technique for those sorts of patients and actually help a lot, but it does carry a small risk of it making it worse, unfortunately. I think the important thing that when it comes to cracking and manipulation in general is that patients need to be aware that they should always be informed that that's what's going to happen and that's the proposed technique, and the patient is in full control. If you don't want that joint to be cracked, you don't want it to happen, you should be given that opportunity to decline, and certainly if you don't want any of that, then you can tell the therapist that you don't want that sort of technique to happen during that session. Well, we assess and vet all our osteopaths before they work in our clinics. We also insist that they are dual qualified in medical acupuncture as well as osteopathy when they come to work with us. And in addition to that, several of our osteopaths have additional qualifications such as being a Pilates instructor or being personal trainers.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.